An ECG, also known as an EKG, stands for electrocardiogram. And an electrocardiogram assesses the electrical conduction system of the heart. And the whole role of the electrical conduction system is to get your heart to contract and pump blood throughout your body. So to help us really understand how to interpret an EKG, we first have to go back to the basics and talk about how the blood flows through the heart and apply that to how the electrical conduction system causes that to happen. So first, let's look at the heart blood flow. Everything starts on the right side of the heart, and blood that needs to be replenished with oxygen will enter into the right atrium. When the right atrium becomes full, it will be stimulated by the electrical conduction system and cause it to contract, and it will send blood down through the tricuspid valve into the right ventricle. The right ventricle will become full, and whenever it receives stimulation from the electrical conduction system, it will contract and send blood up through the pulmonic valve into the pulmonary artery, where the blood is going to go into the lungs and gas exchange is going to occur, and then that blood is going to get oxygenated again, enter in to the left side of the heart through the pulmonary vein. It will go down through the left atrium. Left atrium receives the electrical signal to contract once it's full, and it will contract and send the blood through the mitral valve into the left ventricle, and the left ventricle will contract whenever it receives signal up through the aortic valve and into the aorta, and then it'll go through your body and replenish your tissues with fresh oxygenated blood. But in order for this process to occur smoothly, we need the electrical conduction system to send off these electrical signals that target the cells of the atria and the ventricles so they will contract and relax. So, in order for the electrical conduction system to do this, it has to cause repolarization and depolarization of these specialized heart cells. So these are two terms that you really want to make sure that you understand whenever you're studying EKG interpretation, because they really lay the foundation for understanding this PQRST complex. So here I have a heart cell. It's resting, meaning it's not really doing anything. It's just hanging out until it's told to do something. So whenever you have a resting heart cell, it is negatively charged on the inside, and we can refer to this as it's being polarized. And this cell, the reason that it's like that is because there's a different concentration of ions on the inside compared to the outside. And this cell membrane around the cell is really not permeable right now. It's impermeable, specifically to sodium. There's a lot of sodium outside the cell, and it would love to get on the inside. So whenever this cell receives a jolt of electricity from this electrical conduction system, it really changes that cell membrane and causes it to be more permeable. So that sodium's like, hey, I can get inside that cell now. So the sodium goes inside the cell, and it changes its state from being negative to less negative. So a little bit more positive, because sodium's positive, and it causes depolarization. And whenever the cell becomes depolarized, it causes it to contract. So the next step after contraction is relaxation. So after we have contraction, it relaxes, we get repolarization, it's going back to its negative state. So what you want to take away from this is that depolarization leads to contraction. So whenever I'm saying atrial depolarization, I'm talking about atrial contraction, the contraction of the atria. Whenever I'm talking about repolarization, I'm talking about relaxation. And to help you remember that, to keep those two straight, remember that the word relax starts with RE, repolarization starts with RE. So whenever I refer to ventricle repolarization, I'm talking about the relaxation of the ventricles. So now let's look at the specific parts of the electrical conduction system. Normally, everything should start here in the SA node. The SA node stands for sinoatrial node, and it's located in the right atrium in the upper part of it. And we like to refer to this as the pacemaker of the heart because it causes your heart to beat at a rate of 60 to 100. Now, the SA node is responsible for making the atria contract. So it causes, when it fires, it causes atrial depolarization. So whenever the electrical signals leave here, goes through these internodal pathways. Over here we have a pathway so it can actually get over here to this left atrium because it's a little bit over there, called Bachmann's bundle. And then it goes down and hits the AV node. AV node, that stands for atrioventricular node. And we refer to this node as the gatekeeper. And why do we call it that? Well, the AV node helps delay or slow down impulses for just a little bit because it's allowing these atria to fully empty themselves and allow the blood to go into the ventricles, because we don't want there to be leftover blood in the atria before the ventricles contract, and we don't want the atria and ventricles contracting together because we would have problems. So signal will leave here, it will go down to the bundle of His. So now we're ready for ventricle depolarization. So what's that going to lead to? That's going to lead to contraction of the ventricles. So it goes down through bundle of His. It's going to go down through the bundle branches. You have right bundle branch, you have left bundle branch, and then it's going to hit the Purkinje fibers. So whenever this system occurs, the electrical conduction system shooting from SA node all the way to the Purkinje fibers, we can pick this up and we can look at it and we can see it as our PQRST complex. So if everything's occurring normally like it should, everything's coming from our SA node, originating there, it's firing the way it should, we should have on our EKG strip a beautiful normal sinus rhythm with all of its parts measuring perfectly and forming perfectly. But if there's an issue with this system, we can get dysrhythmias. We can get like atrial flutter, atrial fibrillation, VTAC, etc. So now let's see the heart in action, how it actually contracts and relaxes whenever it is stimulated by this electrical conduction system and creating this PQRST complex by looking at this animation. First, the SA node fires, and this causes atrial depolarization, which causes the atria to contract. Then the signal goes down to the AV node, and notice the AV node does not fire until those atria are empty and the blood is in the ventricle. Then it's time for ventricle depolarization, so the signal travels down through the bundle of His to the bundle branches, and then the Purkinje fibers, causing ventricular contraction followed by the relaxation of the ventricles. So now let's look at this PQRST complex in detail and apply it to EKG strip paper. Now, whenever you're analyzing a patient's rhythm and you're trying to interpret what kind of rhythm this is, you're going to have a lot of these PQRST complexes, or EKG, on EKG strip paper. And you want to be familiar with the EKG strip paper because it's made up of small boxes that are contained within large squares. And each box represents a measurement of time. And whenever you're starting out analyzing these rhythms, you want to be familiar with the basics, like how to measure certain parts of this complex, what each part of this complex should look like. Is it regular, irregular, its rate, and so forth. So I want you to memorize the following information. On this EKG strip, each small square that you see represents 0.04 seconds of time. And each large square, it contains 5 small squares, so it represents 0.20 seconds of time. And the reason you want to memorize this is because you will be analyzing these small squares to determine the duration of certain parts of that PQRST complex. Next, you want to memorize the PQRST complex and all the little extras found within it. So first, let's look at the P wave. The P wave represents atrial depolarization. So this leads to the contraction of the atria, which is created by the SA node. So whenever those atria contract, it creates this little wave. Now, right after the P wave and before the QRS complex, we can find the PR segment. And the PR segment demonstrates the delay the AV node created. Remember, it was the gatekeeper, so it gave the atria time to dump its blood into the ventricles before the ventricles contracted. Also found in this area is the PR interval, and I really want you to remember the PR interval because we measure this and it's very important in determining if your patient has a heart block. So the PR interval starts at the beginning of the P wave and extends to the beginning of the QRS complex. So it's different than the PR segment. The PR segment was after the P wave. The PR interval is before the P wave to the beginning of the QRS complex. And this demonstrates the amount of time it takes for the electrical signal to go from the atria to the AV node. And if it's taking too long, if we have a long PR interval, this could indicate a heart block. Next is the QRS interval, or also known as the QRS complex, and this represents ventricular depolarization. So this is leading to the contraction of the ventricles. Also found in this, but you can't see it, is atrial repolarization, where the atria are relaxing, but the ventricles are so large that whenever the atria relax, it's overshadowed by the ventricles, so you're really only seeing ventricle depolarization here. Then we have the J point, and this is the point where the QRS QRS complex meets the ST segment, and the ST segment represents the completion of ventricular depolarization and the beginning of ventricular repolarization. And this segment should be flat, hence it should be isoelectric, meaning flat. So there should be no depression of it or elevation. And isoelectric is a word that is used to describe straight across lines of the PQRST complex that represents that the heart cells are resting. They're not contracting and causing electrical activity, so none's being transmitted to the EKG. Then here we have the T wave. The T wave represents the beginning of ventricular repolarization, so relaxation. And the ventricles are so big that whenever they relax, it creates this T wave. And then after the T wave, you usually have a flat line, which is representing ventricular repolarization is complete. It's a flat line, isoelectric. And then the cycle starts immediately again, where you get a new P wave, QRS complex, T wave, and it just keeps going on. Now, sometimes after the T wave, you may see a U wave. It's not the case in a lot of patients, but in some patients, and it may be happening because your patient's potassium level is low, like in hypokalemia. And then lastly, here is the QT interval. The QT interval starts at the beginning of the QRS complex and ends after the T wave. And this demonstrates the time it takes for electrical signals to cause the ventricles to contract and then rest. So now let's recap all that information and look at this PQRST complex and see how depolarization and repolarization is occurring in each part of that complex. So here, section 1 is the P wave. That represents atrial depolarization beginning, so we have the contraction of the atria. Then 2, that was our PR segment. That was atrial depolarization complete, so it's done. Then 3 was our QRS complex, and it represented ventricular depolarization beginning, and in there, but you can't really see it, is atria repolarization. It's relaxing. Then 4 is our ST segment, and that is ventricular depolarization completing. Then we have 5, which represented our T wave, and that is ventricular repolarization beginning. And then 6 is that flat isoelectric line, and this is ventricular repolarization complete.